Okay, if you're a parent or a patient, how do you recognize early a brain imbalance or a developing brain imbalance? First of all, one of the classic signs is what we call unevenness of skills, which means that if you have a child that clearly does certain things really well, even when they're very young, some kids might have an unusual memory for certain things like locations, or be really good at Legos, or just be really good at certain things, but yet really struggle and are obviously behind in others. That's almost a guaranteed sign that there is a developing imbalance that will only get worse as time goes on. Other things to look for is, one, are they hitting their milestones? Are they, did they go through the steps? Or you, if you're an adult, did you go through your milestones? You may need to ask your parents. But looking at, did they roll over to both sides equally the way they were supposed to at around 3 to 5 months? Did they do a Marine commando crawl? Did they go to crawling on all fours? If a child does an unusual crawl, or drags one leg, or drags one arm, or rolls instead of crawling, or doesn't really crawl at all, or may scoot on their bus or scoot on their butt, or skip crawling, that's usually a sign that there is a developing imbalance, and that there are going to be retained primitive reflexes that are going to contribute, if not cause, that imbalance. If they walk at a late date, if they don't miss milestones, or they miss milestones like speaking, they should speak 3 to 5 words at 1 year of age. And looking at other things, so other milestones that you may want to consider. Nonverbal communication. Of course, most humans were focused on verbal communication, but what develops first is nonverbal communication. One of the reasons why I called my book Disconnected Kids is because that would be one of the most common ways that moms would describe their children. They would say early on they felt disconnected from their child, or maybe this one particular child, they did not connect like they did with their other children. They noticed that eye contact, that their responsiveness, that reciprocal effects of smiling, and then the baby smiles, or if you frown, the baby frowns. That type of back and forth should be there from 1 month on. It's been shown that in kids with autism, that even as early as 1 to 2 months, that they're not looking at the mother's eyes or facial expression, that they're more focused on objects in the room around them. Another clue that there may be an imbalance will be when they go to school. Again, are they seemingly pretty good in certain subjects and not really, or very delayed in others? Some children may be early readers. They may actually be able to read really early, which is a left brain skill. But yet, when it comes to reading comprehension, they may really struggle. There can be a huge gap between those two, and the right brain reading comprehension is the right brain. Different math, basic math operations is a left brain skill, but math word problems or reasoning or problem solving is a right brain. So, a teacher just assumes maybe that a child should be a good reader, and if they can read, they should comprehend. But these are different brain mechanisms on different sides of the brain. And therefore, there may be this unevenness of skills where they may be really good at word reading, but terrible at reading comprehension. Really good at one type of math, but terrible at another. Another early sign may be if they show some real unusual talents in an area, like maybe art or music, but yet they are delayed in other things, maybe academics, maybe they're very delayed in reading in general. Their emotional regulation. If you see, it's not that there's a comparison, and teachers are really usually good at this. They may point out that your child is not doing what the other children are doing. And that, they may be good at certain things, but that they're not really good at sitting or doing, when everybody gets together. They may be overly active. These are other signs that there's an imbalance. Another sign of a developing imbalance is really looking at your child or at yourself in a mirror and seeing if there's any asymmetries of muscle tone, especially in the face. The face is a window of the developing brainstem and of the nervous system. And if we have asymmetry, nobody has a perfectly symmetrical face, although most people should be pretty close. But if there's obvious asymmetries where the eye is bigger or you see a little bit of the white under the cornea, you shouldn't. That usually means that there's weakness of facial muscles. If the corner of the mouth is drooped, if there's a big difference in this crease on one side of the face or the other, if one side is much deeper than the other, that is a sign that there is an imbalance in the nervous system and in the brainstem, and that's a window really into the autonomic nervous system and the things like regulation of the gut and of the immune system. Another thing that can be looked at is around motor skills. If a child is very, very clumsy, if they seem to really bang into things or fall, or if they have really low muscle tone or floppy muscle tone, this is another sure sign that there's a developing imbalance in the brain. This may show up also as problems with articulation. If a child is really mostly referred into speech therapy early on, they probably have a developing imbalance in the brain. And they're going to need then more than just working on their speech if they have a neurological imbalance that needs to be addressed. Another thing you can look at is looking at their posture. Is there a head tilt? Is there a body tilt? Is there a rotation of the head? The head will usually tilt a little excessively to the side of hemisphere weakness. This has to do with the fact that between an area of the inner ear and the cerebellum and the brainstem and the brain, there's a cross relationship. And so with a right brain deficit, we see a deficit of the left inner ear and the left cerebellum, and this can cause the eyes to rotate to the left. And so the child may tilt their head to the right to bring their eyes back to the middle so that they see the world in an upright way. If we have an imbalance in the inner ear, they might see the world literally in a tilted way, but they don't realize it because it's always been that way. But they may tilt their head or tilt their body to compensate for this in some way. So pay attention to the posture of a child or of an individual and see, is there an imbalance that seems to be obvious? Is there a head tilt? Is there a rotation? Is there facial weakness on one side versus the other? These are things that usually tell you there's for sure a developing imbalance in the brain. Another clue is if your child ever has an IQ test, there are different parts of the IQ test that are really purely left brain skills and others are really purely right brain skills. What we can see is that in an IQ test there might be a big difference between their scores. There shouldn't be more than a 10 to 12 point difference really between any score. But especially if there's a difference clearly between left and right brain scores, that's a window into the fact that there's a developmental imbalance in the brain affecting the hemispheres, and that is usually the source of any issues that this child is being tested for. If there are any things that you suspect that may lead to an imbalance, if you want to learn more, really read my book, Disconnected Kids, and I have a checklist that you can fill out that may really give you more clarity on it for adults or for children. But really you need to address this because these do not self-correct. An imbalance will never self-correct. It needs to be treated. There needs to be an intervention that is going to create balance in the nervous system. And it usually starts with getting rid of these retained primitive reflexes along with stimulating one side of the brain more than the other. And that is really critical. If that's not being done, you're really not addressing the core issue, you're just really managing symptoms.